Ladies and gentlemen, Dr. Leo is here. Now, listen to this carefully. When you are experiencing different symptoms of any disease and you head to hospital and you're diagnosed of a disease, let's say like malaria or typhoid or pneumonia or any disease that has a causative agent, let's say protozoa, let's say bacteria or viruses or fungi, you will be treated with appropriate medication that will clear this disease, and afterwards the symptoms disappear. So nobody is focusing on treating the symptoms. We actually focus on treating the disease so that when the disease disappears, the symptoms will follow suit. They will disappear. Now, why is it the opposite when you're trying to manage lifestyle conditions or dietary conditions like diabetes, like hypertension, like cancer, like heart disease, or nerve problems? Why do we focus on treating the symptoms and not treating the cause? Is it that these diseases that have a causative agent like malaria, is it that because they are short-lived, could it be that they are not lucrative businesses? And the others that are prolonged, the chronic conditions, are lucrative businesses for the big pharma and the food industries? Because as you continue suffering, we will continue making money, because you'll continue coming to us and giving us money to sell you drugs or to give you drugs. But the real sense is these drugs are only handling the symptoms of diabetes, the symptoms of hypertension, the symptoms of cancer, and the symptoms of chronic conditions, even arthritis. So these drugs that are prescribed for these conditions do not treat the cause. They only treat the symptoms, and they help you cope with the disease or the symptoms as the disease establishes itself. Now, when it comes to the end stage of this disease, that is too late. That's the time when we want to give you the attention that you want. We want to give you dialysis. We want to give you heart surgeries. We want to help you lower your cholesterol levels. But why didn't we just start from the cause? We already know that these diseases are caused by consumption of processed foods and carbohydrates, wheat products, seed oils, and sugar. Why didn't we just advise you to drop those foods? Why did we allow ourselves to just give you drugs, knowing that these drugs will only handle the symptoms as the disease establishes itself? Listen, these are diseases that are lucrative businesses, and therefore, as we treat your symptoms, you will always be our slave. Number two, as the disease establishes, we will tell you it is irreversible, so that we sell you the fear and you continue being our customer. So, focus on dietary modification. Take a look at diabetes. These are the classes of drugs that are used to treat the symptoms. Underline the word symptoms of diabetes. They do not treat the cause. Number one class of drugs that treat the symptoms of diabetes is biguanides. An example of drug or a drug in this group or in this class is metformin, a very common drug, and most of you are on metformin. If you are pre-diabetic or if you're diabetic, you're given metformin as a standard drug. Number two, we have drugs called sulfonylureas. An example is glibenclamide and also glimepiride. I don't want to mention the trade names, but if you want to understand drugs, when you see that drug package, the bigger name, the one that has an R with a cycle, is what we call the trade name. That's a name that is given to that drug by the company. But there's another name that is written in very small letters, maybe a small font, just down that word, that trade name. That is what I'm mentioning. That is what we call the generic name. So as you read those packs, you can also relate to these generic names that I'm mentioning. Number three is what we call meglitinides. And in this group, we have a drug that is called repaglinide. Number four, we have thiazolidine diones. And in that group, we have a drug that is also commonly used and is called pioglitazone. Another one, number five, is what we call DPP4 inhibitors. Now, in that group, we have sitagliptin. Number six, we have GLP-1 inhibitors. And in that group, we have a drug that is called liraglutide. Number seven is SGLT2 inhibitors. We have dapagliflozin. Okay, and then now another one, we have insulin injections. So those are basically 8 classes of drugs. Now I want you to understand, between number 6 and 7, the GLP-1 inhibitors and SGLT2 inhibitors, the drugs that come in that group, they are well known for causing pancreatitis. They inflame your pancreas. So come to think about it this way, diabetes is high sugars in your system, not in the blood, in the system. Now, they tell you that in diabetes type 2, you have insulin resistance, and therefore your insulin levels are high and your sugar levels are high. But insulin is coming from the pancreas, and therefore if insulin is coming from the pancreas and you have a drug that is actually causing you a defect in the pancreas, how are we solving the situation? It is not making sense. So you're treating symptoms of diabetes, then you end up getting pancreatitis. So that has to be a question mark. Now let's continue. When you want to treat diabetes, this is what you should focus on. So this is what is treating the cause of diabetes, not the symptoms. The ones I just mentioned are for the treatment of symptoms. Now this is what you do to treat type 2 diabetes, to be specific. Now, 1, fatty protein. The system has told you to always consume lean protein when you're diabetic. However, when you take lean protein, you will be tempted, or you might end up overeating protein. That's the reason why those people who eat lean meat, they end up overeating this and they don't recover from these conditions, because lean meat, fat is a satiety food, proteins too, but you cannot eat lean protein because those are hunger. It will actually be converted to glucose, because remember, we have gluconeogenesis. So you will overeat it because you will not regulate satiety, because fat in that protein, the reason why I said fatty protein is because that fat is the one that is responsible for satiety, and also it does not cause any spike in insulin. So if you eat fatty protein, you'll get full. You'll not eat for a long period of time. That's what we want. So you'll start going through intermittent fasting. Now, eat fatty meat. Concentrate on fatty protein. And then the meat, red or white meat, enjoy them. Make them fatty. The eggs, the fish, seafoods. Enjoy organ meats, the liver, the kidney, the heart. Enjoy them in plenty. Okay? And then, number 2 on the list. And before I just go to number 2, beans are not proteins. Beans are carbohydrates. So if you want to consume beans, just understand that beans are complex carbohydrates. Do not consume beans thinking that they're protein. They are not. Number 2, essential fats. So you're going to drop your cooking oil, which is the seed oil, and focus on essential fats. And what are the essential fats? These are basically coconut oil, the saturated fats. The system tells you to eat or to consume unsaturated fats or vegetable oils. These are so unstable, and these are the ones that form radicals, and these radicals are the ones that will expose you to even more problem and systemic inflammation. Remember, these conditions, the chronic conditions, are inflammatory conditions, so you need to avoid inflammation. So drop those unsaturated oils, drop those seed oils, drop those vegetable oils, and then use essential fats. Avocado oil, very good one. Coconut oil, a very good one for even deep frying. It can withstand higher temperatures. Ghee, tallow, lard, sweat. You can use that. You can even use butter. So these are the essential oils. Again, remember, olive oil is monounsaturated, so it has one double bond. So it is still unstable under high temperatures, and therefore you should not use olive oil. You should not expose it to very extreme temperatures. You can use it for shallow frying or to top dress your salads. Okay. And then number 3, fasting or restricted eating. If you're diabetic, you actually have high insulin levels, and that is what is preventing you from burning fat and glucose that is stored in cells as fat or as glycogen. And therefore you need to lower that insulin, and the only way to lower this insulin is 1, to stop eating carbohydrates, and number 2, to start fasting. Whether intermittent fasting or prolonged periodic fasting, they will be necessary for your recovery. So you can move your breakfast to around 11 to 12 noon, and then you move your last meal to around 6:30, and in between you do not snack. Just take water that has a pinch of salt to hydrate. Okay. And then on fasting, when I talk about fasting, most of the times I'm told that diabetics should not fast and they will end up maybe fainting or with low energy and stuff. That is a lie. I want you to know this. If you are diabetic and you're using diabetic hypoglycemic agents, those diabetic symptoms treating drugs, I'm using that phrase intentionally. Diabetes symptoms treating drugs like insulin, like glibenclamide. These are drugs that are called hypoglycemic agents. So they're supposed to lower your blood sugars. That is a problem. So you cannot fast when you're using these drugs, because if you're using these drugs, already the drugs, side effect of this drug is hypoglycemia. So you're actually blaming fasting for what diabetic drugs are causing you. Do not blame that. Diabetic patients should start fasting. You should fix your kitchen and then start fasting, and then after that you can tap down this or tap out these drugs slow by slow, and then get rid of those drugs as you adapt the dietary modifications. So those are the drugs that cause you hypoglycemia, is not fasting, because remember, a diabetic patient has a lot of glucose in his or her system, and this glucose is stored as fat and glycogen. So you need to burn that to give you glucose. So the body will never allow you to go into hypoglycemia, yet your body cells are filled with glucose. It's not making any sense. And then remember, always workout and exercise in the gym, hits, and also weightlifting. Very important for your recovery, because this will improve insulin sensitivity to your cells. It will also improve fat burning. And do not go into the gym and come out of the gym and eat so much food or eat bad diets, because you want to be in a caloric deficit state. Your body has to be in a deficit state, caloric deficit. So if you go to the gym, you've burned the fat, and then you consume carbohydrates or you consume a high amount of protein, which is lean protein, you're actually messing it up. You will go back to where you started. So you're walking one step ahead and 7 steps back. Doesn't make sense. And therefore also understand, fasted workouts are the best because they maximize on fat burning. Okay? And then sleep. You need 8 hours of sleep every night. If you're diabetic, if you're hypertensive, you have cancer, all chronic conditions including arthritis, you need to balance your hormones through sleep. You also need a recovery. And then the sun, because the sun is an endocrine stabilizer. So it means it stabilizes all your hormones, and also it helps you boost your immunity, and it's actually the power source for our energy. So enjoy the sun. Now once you do that, this is adequately 70% of recovery from chronic conditions. And this is basically maybe a nutshell or a breakdown of how you can recover from those chronic conditions and their metabolic syndrome. So this is for those people who have been asking me about how to manage diabetes. So drugs will not help you treat the cause. They will help you cope with the symptoms or with the disease as they treat the symptoms. They mask the symptoms. And then later on, you'll get into dialysis. That is very expensive. You'll go into heart failure. You'll go into brain, the stroke. So every condition is leading to another. So be cautious when you're using these drugs. Okay, drugs were designed to be emergency treatments or short-term treatments. So you cannot take these drugs for 10 years and still think that you'll recover one day. You cannot. You'll have to fix the kitchen. Okay.